Hi everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom to 2 girls. So this is a continuation of part 1 of the products that I often recommend when it comes to starting solids, products that I've either used personally or I recommend to my patients. Of course, this is not a comprehensive list, and if you have products that you found helpful, please leave them below in the comments. I'd love to learn more about what things have been helpful for you when it comes to feeding your kids, either at home or on the go, whether you're doing puree feeding, baby-led weaning, or a combination of both. So next up is the Oxo Top Food Masher. Now, I personally have never really invested in a food masher, and I'll tell you why. Usually I'm at home or I am, mashing it with a fork and it's not a big deal. But sometimes it's really nice to have something, especially if you're on the go. Sometimes you find it maybe a little bit messy to mash things with just a fork. That's why I've seen a lot of families invest in this, and it's been really helpful for them. I've literally seen them mash food in the doctor's office while I'm talking, and they're able to literally prepare a little puree meal for their baby while they're in the office and I'm talking to them. Now, I'll tell you why I like them personally. If you're transitioning from purees to chunkier foods, this allows you to really control the texture. Even if you're just beginning on your baby-led weaning journey, this allows you to sort of get thicker textures that are easier for a baby to potentially self-feed even. So you don't have to necessarily mash things to pulp. Does it work well for softer items like steamed carrots or mashed banana? Yes, it does. But I'll be honest, even as your child moves into toddlerhood, you can use this as they start to develop teeth too. So mashing up things like chicken, garbanzo beans. So even thicker, meatier textures, you can use this same device to help give you a smaller, easier to sort of break down texture. Now this next one is definitely one of my favorites when it comes to still being in the puree feeding phase for your child. This one is the Boon Squirt Silicone Baby Food Dispensing Spoon. That's a very long name. But essentially what you can do is fill this little part of the spoon with whatever it may be. Let's say it's one of your puree cubes from your Mummy and Bubby freezer trays. Whatever it may be, let's say it's applesauce. You can literally put it in this end of the spoon, screw the lid on, and then if you squeeze the spoon, the food comes out onto the tip of the spoon. This is so helpful when you're feeding on the go. And I will say it definitely has a time that you can use it, right? I probably wouldn't be using it past definitely 12 months of age. But if you're like still in the young phases of puree feeding or something like that, I think that this can be really helpful because you definitely, with this hole that comes out through the spoon, you have to do a lot thinner textures. So this is not going to be a time that you're going to be doing chunky purees because they just won't fit onto the spoon through the hole in the silicone container. It does hold up to 2 to 3 ounces and it's dishwasher safe. So when I have used it, again, I thought it's very helpful. It's pretty much mess free as well, about as mess free as it can get when it comes to feeding a baby purees or something early on. But definitely I feel like it's something that's worth having around in the house. I've used it for both kids. Now let's segue away from spoons, away from puree feeding, and let's talk about that first sippy cup. Now, what you may know is that children really benefit from either having a cup with a straw or an open cup to drink out of. Those are really the most beneficial cups to really learn from and practice with. Now, if your child didn't use those two, it's fine, not a big deal, but these are usually the ones that dentists, pediatricians, and speech language pathologists do recommend. Just better for oral motor control and what we know is the most sort of beneficial when it comes to their palate. Now this brand of sippy cup by the first years is the Mickey Baby Trainer sippy cup. Now I like baby trainer straws because they're a little bit more flexible. They're not as rigid. I think again that's a lot easier on little baby gums, especially because having a rigid straw in the mouth is a little hard to get used to. So definitely once your child gets the hang of being able to take water in through a straw, and if you're not sure about how to teach your child to drink from a straw, I do have videos on TikTok and on this platform and my YouTube shorts about how to get a child to take water from a straw and teach your child to drink from a straw. I found that this cup can be very helpful. I will say it is definitely not super durable. Your child drops it on the floor enough, it will crack, it will break, but I find that the straw is really helpful. Now, if you look anywhere for an infant training straw, that's going to be what you're going to want to see, something that's got a little bit of a flexible part that goes in the child's mouth, so it's just not as rigid for them. If you have a sippy cup though that you've recommended and you find really helpful, let me know. Leave it below in the comments. As my children have started to drink well from a straw, we've basically transitioned to thermos water bottles. I found those really durable, really great at keeping liquids the temperature they should be. No matter how many times my kids drop them on the floor, they're pretty resistant. Of course, we've replaced them over the years. Every bottle has its own shelf life and lifespan, but let me know what cups you found helpful. Moving on, let's talk about other tools when it comes to feeding your child. I really love this Munchkin fresh food feeder. This is really great for putting products in and allowing your child to, again, self-feed, and this also prevents hopefully a choking hazard as well. So again, be smart about doing this, but make sure that when you're putting in products, they can still be supervised, but you can allow your child to literally get the flavor of the food without potentially putting that whole chunk in their mouth and it becoming a choking risk. The only drawback is cleaning these. That can be a little bit of a pain in the butt, especially because if you eat things like bananas, it really gets messy and sticks into the mesh framework and gets really difficult to take out. So just a heads up on that. All right, my last and favorite one is this ZoLi on-the-go snack dispenser. It can also hold formula, so I do want to give that disclaimer that it does say it can hold powdered formula as well. I've particularly almost exclusively used this for snacks. I've had it for years and it's amazing. It's like essentially a stackable canteen, so it takes up space in the vertical sense and allows you to really put in whatever snacks you want. Let's say you want to put in puffs, let's say you want to put in Cheerios, pretzels, whatever have you. So I've been able to use this over the years and it's been really, really helpful to give your child variety, but also keep things in a stackable, easy to use, space-saving way. So that's all the products I have for you. And if you have any products that you recommend, please leave them below in the comments. If you didn't see it, the first video also discusses 5 other products focused on baby feeding and just self-feeding or puree feeding, baby-led weaning that I recommend and have either personally used or recommended to my patients. If you found these videos helpful, make sure you give it a thumbs up and I'll see you next time. Bye.